This is Krista Michener. Welcome back to Made to Be Whole. Today we are going to talk about the fascinating and terrifying world of PANS and PANDAS. Stay tuned to find out what that means.
Made to Be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
All right, welcome back. So we're going to learn today about PANS and PANDAS. So both of those are acronyms, and we're not talking about pots and pans or the fuzzy bears. They're also known as basal ganglion encephalitis or autoimmune encephalitis. And I'm going to point you to some good resources, but give you a little bit of education about what those things stand for. So PANS and PANDAS are both autoimmune disorders that affect the brain, and they're triggered by infections. So these can be infections like the vector-borne infections we've talked about. This can be strep infection. So pediatric acute-onset neuropsychiatric syndrome is PANS. So pediatric, meaning this is typically a young person, even though we do see it sometimes in adults in their 20s. Acute onset, meaning sudden. Neuropsychiatric, so neurological or psychiatric syndrome, so a group of symptoms that happens together. So it's a clinical diagnosis, meaning it's primarily based on symptoms, though we do look for supporting labs. And it happens when a child or adolescent or young adult has a dramatic onset of neuropsychiatric symptoms that typically include either obsessive compulsive symptoms or food restrictions. So I have situations like this in my family, but patients who can tell you the day their child, quote, got OCD. OCD doesn't just happen. If you wake up and you're like, on November 11th, I had a different child than I've had for the last 13 years. They were suddenly afraid, they were raging, they were anxious, they had obsessions and compulsions, they had tics. Something triggered that. That's inflammation in the brain that was triggered by an infection. So, and there can also be metabolic things or stress, other things that trigger it. But typically there's an infection, and you really hope and pray to find one so that you can find that smoking gun and treat it. PANDAS is a little more specific. So PANDAS is pediatric autoimmune neuropsychiatric disorder, but associated with streptococcal infections specifically. So sometimes this will be, my kid had strep throat and then our world fell apart. But sometimes the strep is other places, scarlet fever or perianal strep, meaning strep that you can culture out of the anus. A telltale sign for that would be a red ring around the anus. That would be something to be alarmed about. I've also had patients where I found the strep in their urine, and it's interesting because it's so hard to trace the symptoms. It would be so much easier if somebody had classic infection symptoms too, but that doesn't always happen, and that's what makes it so difficult. So what you can see with the presentation is these uncontrollable emotions, being irritable, anxiety, loss of academic ability and handwriting skills, which I think is fascinating, and I've seen this. You have a kid who was a straight A student, or they were really neat, or they were a great artist, or they're little and they love to color and they colored in the lines and drew their pictures, and then suddenly they can't do their schoolwork, they're failing classes, they've gone from beautiful writing or drawing to scribbling. That's a warning sign. Again, this is with permission, but looking back after I've delved into this world and learned about this, I realized that this is how infection first presented itself in some of my kids. So And part of me wants to cry when I talk about this, but that's all right. So there's some that don't like me to share their stories. I won't, but the ones who are okay with it, my daughter was incredibly outgoing, incredibly confident, good student, loved school, absolutely loved school, would sing solos in school and at church. I mean, she was just kind of on top of the world. And then when she was 10 or 11, I think it was fourth grade, but just sudden onset of severe disabling migraines and then associated with anxiety and then like really significant regression in social skills. And also you'll see attachment issues where a kid who was confident all of a sudden just they have to be with mom or dad. It's like the little kid going through that phase. They want to hold on to you constantly. They're afraid of other people. Their social skills completely tank. And she was in bed for about 2 months. We finally got her back to school, and the school was really, I mean, they were really awful. It was really heartbreaking to me because they just said, well, this is just anxiety. First of all, I don't know anything that's, if you've ever had severe anxiety, there's no such thing as just anxiety. It can be pretty hellish, but she had these awful migraines. I remember once her getting sent to the nurse's office, and she was laying down, she had a migraine, she was fine, and I get a call from the principal talking about how disrespectful she is because she was in the nurse's office laying down in the dark and she was fine, but then when they had her get up and try to go to class, she was complaining and she was saying that her head hurt, and I just thought, you're an idiot. You're an absolute idiot. Anybody who's had migraines knows that light, movement, and noise make them worse. And for this kid, I was glad that she actually finally stood up to them because for a long time I kept saying, Izzy, just go back to school because if you're sick, you can tell them, they'll take care of you. And she said, no, they won't. All they do is take your temperature, and if you don't have a fever, they say you're fine, go back to class. And that, unfortunately, has been my experience and is what led me with my kids' health problems to a lot of them we did either periods of homeschooling or online school. We're really grateful to live in a time where we have those alternatives, but it's a big deal. So you have the sudden onset neuropsychiatric symptoms, anxiety, especially OCD type stuff, being obsessed with cleanliness. Or I remember my oldest one when I can look back and say, there was a PANS PANDAS element to that because I remember distinctly he was always dysregulated, always. But when he was like kindergarten age, all of a sudden it would take me 30 minutes to tie his shoes because everything had to feel just right. We had to get rid of clothes and buy very specific clothes with a tag that didn't bother him. He became like very rigid with his handwriting. Everything had to be done in a very specific, detailed way. And I don't think I really connected the dots because there had always been dysregulation that this might be something new. He was diagnosed by one counselor with OCD, but it was just all of these like migratory psychiatric symptoms. And what's fascinating is, after we figured out infections that were going on, which unfortunately was over a decade later, stuff that he had been dealing with since he was a very young child resolved. He told us as an adult that ever since he was 4, he would have these involuntary urges to like push me down the stairs or hurt me, and like these surges of rage, and he would have to pull his arm back and hold on to it to stop himself from hurting me. And I asked him, Dana, why didn't you tell us this? And he just said, well, I thought that's what everyone dealt with. He just thought that was normal life. So no wonder he went from being highly active and hyperactive to being completely exhausted because you've got this combination of infection and inflammation plus the mental effort that it takes to like stop yourself from hurting people all the time, which your body wants you to do, but you don't want to do it because you're a good kid. It's not what you want. I watched a really fascinating documentary recently that you can check out on YouTube. It's called Stolen Childhood. And the title really resonated with me because Another of my kiddos has told me, I feel like these infections have robbed me of my childhood. The times I should be out doing things with friends and working and doing all the great things you do when you're a kid. He didn't have that opportunity. And how do you balance as a parent having compassion for that and mourning and allowing that mourning process, but then with also trying to say, but hey, we know now because there are people who never figure this out. So it's a tricky balance, and it's tricky as a parent too because you have to mourn. I mean, sometimes you just have to cry and say this is terrible and this isn't fair. I mean, it's not. I know life's not fair, but this isn't fair. This is a very unfair thing about life. But it is a blessing if you can eventually get answers. So, one good resource if you want to read more about these, there is some good information at Stanford Children's website. Stanford is a really big academic research center for PANS and PANDAS. And just for those of you who still think things are cut and dry in medicine, and if something's real, everyone will agree on it, even though Stanford's one of the academic destination centers, there are still children's hospitals that I'm aware of, even in the state of Ohio, who tell parents that this isn't a real thing, not a real thing. When you have sudden onset eating disorder type stuff like restricted eating, either eating not enough to sustain life or even I used to eat all of this stuff and now I only have a few things I'll eat and very texture focused. That's an OCD type symptom, and that's another indication that something might be going on. So if you go to stanfordchildrens.org, they've got some good resources there. There's also a website, pandasnetwork.org, so PANDAS network.org is a good one. And then Dr. Nancy O'Hara has written a really good book called Demystifying PANS and PANDAS. She also has a website, drohara.com. I've done some educational things through her. She's got educational resources for parents and for healthcare providers, and she's been a really great advocate. So if you think, oh my, I think this might have been what happened to me or my kid or niece or nephew or someone in my class, let me tell you where you can start as far as diagnostic help. First of all, it is more prevalent than people realize. If you go online, a lot of things say, oh, it's extremely rare, it's extremely rare. But statistically, 1 in 200 kids has this. So even though that's rare, say you're at an elementary school that has 400 kids, 2 kids, that's not insignificant. I mean, you would be shocked if there were 2 kids in your kid's elementary school who had cancer. That would seem horrific and kind of high for someone that little. So 2 kids in every, 400 student school, or if you go to a high school that's got 1,200, that's at least 6 people who are suffering from this and who are probably being shuffled around the mental health care system and being given medications that, although they have their place, aren't really going to help this. I have one patient who, before he came to me and we figured out this is what happened, had been hospitalized because of the severity of psychiatric symptoms, and the only time they really helped him was when they had him on so much medicine that he was basically sedated all the time. Well, that's not a fix. So if you're looking for a lab workup, if you're starting with things that are covered and are pretty straightforward, a strep culture, a strep anal culture, and even a urine test to look for infection. Other infections that you can check antibody levels for, so mycoplasma is a good one. And I'll put in our show notes a list of some of these tests that you can request. And some of them, if you're banging your head against a wall and don't have someone who can order them, there are, as I've mentioned in other episodes, self-pay labs that you can just say, self-pay lab near me, and type in some of these tests and order them yourself, so at least you've got some information. So I would do cultures. You can do a nasal culture too. I've found some crazy stuff in people's noses that are contributing to psychiatric symptoms. When we cultured Daniel, this is in the last year, and found unusual bacteria in his nose and started a nasal spray for that, he had some severe psychiatric herxing. He's like, oh my gosh, mom, like, this is making me more agitated. It's making my sleep worse, which tells me, okay, well, this is an infection that's close to the brain. We're getting die off there. So we backed off the frequency and the amount to ease into it a little more. There are also strep antibodies. So there's two types of strep antibodies that you can check. There's the ASO and the anti-DNA ASE-B. So again, I'll put that in the show notes, but I would check those types of strep antibodies. I just got back results this week from someone with really sky-high strep antibodies who we had been doing some digging for. Typically, if you have insurance, those sorts of things can be covered by insurance. You also have to look pretty closely if those things don't pan out at this world of vector-borne infections that I'm so passionate about, particularly Bartonella. Bartonella can cause a lot of psychiatric distress, as can Lyme, Babesia, the other vector-borne infections. Obviously, you can look at viruses. We talked in our last episodes about viruses that can cause inflammation in a lot of the organs of the body, including the brain. So I would be doing Epstein-Barr virus titers. I would be doing Coxsackie virus titers. I'll put a list of various viruses that you can check for. The other thing you are going to want to dig into at some point is, does this child or individual have an immune deficiency that's making them prone to this autoimmune reaction? So obviously lots of kids get strep, but they don't all get pandas. So why is it that some kids have this reaction? So you can look at immunoglobulins. So what you would want to do is order an immunoglobulin test that looks at AGE&M. So IgG, IgA, IgE, IgM. Ig stands for immunoglobulin with your IgG subclasses. I also look B cell and T cell studies. Those are looking at those really critical components of your immune system, because if you have a deficiency there, your body's never going to be able to mount the appropriate immune response to tackle this. As far as treatment goes, and I'm going to back off and add one more thing about testing. So a very specialized form of testing that is typically not covered by insurance, but that is considered diagnostic. It's through Molecular Biosciences. So their website is www.moleculera.com, and it's the autoimmune brain panel, sometimes called the Cunningham panel. So what they're looking at is looking at the levels of autoantibodies. So these antibodies your body's made against yourself, against your brain. So autoantibodies against two types of dopamine receptors, as well as some other things that really affect brain health. And they can look at these tests and figure out from that, is this a PANDAS type thing? So anti-dopamine D1 receptor is one. So you've got these dopamine receptors everywhere in your brain, and they affect cognition, emotion, your body's ability to regulate whether or not you're hungry or full, locomotor activity, so motor skills, because we'll see declines in those, and the endocrine system. So endocrine is hormones. So those things will affect potentially diabetes risk, sex hormone production, all of this. So your dopaminergic system, I'm going to trip over that word, but when it's dysregulated, it can trigger things like schizophrenia, ADD, depression. So when your body makes these autoantibodies and directs them against the receptor, then it's either stimulates it so things are overproduced, or it can block the ability of dopamine to bind to it. And so you can see that could have widespread effects depending on the individual, but including psychosis, OCD behaviors, tics, that sort of thing. So that would be a big deal to identify. And you can see how in that situation, just trying to manipulate levels of neurotransmitters, like, oh, we want to do something to like boost dopamine production or or maybe you've got dopamine overactivity, like why these traditional psychiatric medications aren't going to be able to make a real dent in it. They also look at the anti-dopamine D2L receptor. So those affect their dopamine receptors, but they have a little different activity in the body. So this is also widespread, can affect the same sorts of things, but the dysregulation of that pathway has been linked not only with schizophrenia, ADD, depression, but also addiction, Alzheimer's, Parkinson's. So a lot of things that affect not just psychiatric, but the motor system, movement. You will see if you watch the documentary I mentioned and look for videos where kids will be like normal 1 minute and then not the next. It like comes and goes in waves is another clue. Sometimes those waves can last a long time, but where like they can't get their words out or their face is doing contortions or they're doing like vocal tics where you got a like a throat clearing tic can be associated with strep. So they're looking at that receptor. The next one is the autoantibodies against lysoganglioside GM1. So it's found inside the membrane of your nerve cells, and it's mostly in your nervous system, and it's like an insulation around your nerves, and it's really important for signal transmission in your brain. So your brain's an electrical system, and these signals are getting shot to different places to tell your body how to move, act, think. So when you've got autoantibodies directed against this particular thing, it can interfere with normal nerve transmission. So you can have joint pain, tissue pain, headaches, other types of neuropathy. One thing that some people are more commonly aware of is Guillain-Barré or Guillain-Barré, depending on who you hear pronounce it. But that's another autoimmune response against those antibodies that's usually triggered by vaccines that can cause paralysis. So then you've got the anti-tubulin autoantibodies. And I know this is all Greek, but it's just to give you a taste of the sorts of complex things happening in the brain to help us understand what's going on with this kid and to try to do more than just calm them down, because it's not just about calming down, it's about fixing something that's broken. So if you've got autoantibodies, so again, your body attacking tubulin, what you're doing, tubulin is a protein inside of your cells that's really important for maintaining like the shape and structure of your cells and transport of different substances within the cell. It's in most cells, but it's really, really concentrated in brain cells. It also has a lot to do with cell signaling. So not only can you get OCD type symptoms with this, it's been associated with brain fog, which is not a technical term, but if you have it, you know what I'm talking about, just that cognitive impairment where you just, you know things, but you can't come up with them, or your brain is like wet cement. It's just really, really difficult to think, and things that should happen really quickly do not happen really quickly. And then last we have the CAM kinase. So calcium calmodulin dependent protein kinase 2, or CAM kinase 2. So it is a really important enzyme that helps the neurotransmitters dopamine, epinephrine, and norepinephrine, which are obviously highly involved with mood, emotional regulation, and then also neurotransmitter synthesis and release, so your body's ability to make enough of those things, and also knowing when to let them out, and the little receptors that are supposed to be picking them up to be able to do it. So it's huge for that whole thing. And so if you've got autoantibodies against CAM kinase, then you're going to have, again, neurological issues, psychiatric issues, behavioral issues. So why this autoimmune brain panel or Cunningham panel can be really helpful at some point. First of all, it's diagnostic. I mean, most people, even my outside providers that patients I've worked with that are really not exceptionally open-minded, do tend to look pretty closely at this as diagnostic, which is good and bad. It's good because, of course, we want to them look, but it is a clinical diagnosis. If you have this sudden onset neuropsychiatric presentation, and you can identify that there was an infection present, why are we wasting this family's time and sanity and not just trying to get to the point? But what you want to do, you want to reduce inflammation, you want to treat the infection, but sometimes that's not enough. And if you get a positive Cunningham panel, then sometimes you can get qualified for what's called IVIG, or intravenous immunoglobulin, which is an IV treatment that happens over the course of months typically, that's helping to give immunoglobulin, give healthy immune cells to your body so it can mount an appropriate immune response. I would warn parents or patients, though, that this is not the magic bullet. Some people think, oh, I can't get IVIG. If I could just get IVIG, all my problems would be solved. For some people, it is really critical. But if you're not taking care of other things, I have patients who have had it and they'll have gains, or they'll have short-term gains, but then everything comes roaring back because if you haven't turned off the inflammatory mechanism and identified and eradicated the infection, it's not going to be a long-term solution. Sometimes this involves longer than typical antibiotic doses, and even neurologists will acknowledge this, or my infectious disease people who don't believe that you can have chronic Lyme disease or Bartonella will acknowledge, oh, well, when you've got this reaction, then you may have to be on penicillin long term if you had high strep antibodies. So that is something that can help. But it's just so individualized. That's my whole thing with this. When you have PANS and PANDAS, I remember hearing a church speaker saying once that he heard the story of a woman who had just gotten married, talking to her mom, saying how happy she was because now that she was married, that it was what did she say? She's at the end of her problems. And her mom said, well, yeah, but what end? Is it the beginning or the end? It's kind of like that with a PANS PANDAS diagnosis. When you get the diagnosis, it ends kind of that questioning and you have an answer to why. But then the nuance that's involved in getting proper treatment it's pretty intense. One thing that you can do symptomatically, and that can also give you a clue of what might be going on, say your child or you just have this intense increase in anxiety or OCD symptoms, and you give anti-inflammatories. You say, I'm going to do a pretty hefty dose of ibuprofen. I'm going to take, and again, consult with your provider, but if you're a full-grown adult and or a teenager that's bigger, if you do 600 to 800 milligrams of ibuprofen, which would be 3 or 4 over-the-counter ones, and I do prefer the gel tabs in this case, like the Advil gel tabs, I prefer those a little more. But if you're having this flare in rage or anxiety and you take ibuprofen and you feel better, you're going to want to scratch your head a little and say, okay, if this were a neurotransmitter problem, if this were because my serotonin or dopamine or norepinephrine were out of balance, ibuprofen really shouldn't make that better. We need to dig a little deeper. Some of the other anti-inflammatories we talked about in our last episode, like turmeric, Cytoquel, there's a variety of different things. So having some anti-inflammatory things in your toolbox to help during a flare can helpful. But it's going to be critical, first of all, for you to find out what is the smoking gun. Figure out what infection is causing this, and don't be afraid to treat it. Don't be afraid of antibiotics. If you're supporting the gut and detox pathways, they can literally save your child's life. Please reach out for support. It's a very isolating situation. People just don't understand. They'll look at your kid and say, well, he can obviously control himself because he was fine this day when this happened, but not this day. He's choosing this. No, there's something much bigger going on, and you probably know instinctively there's something extra going on, and you just don't have the answer. This could be huge in turning the corner. So don't give up on treatment, and then look at ways to modulate the immune system, which is a whole series upon itself. Definitely, I think in these cases, looking again at genetics and nutrition and anything else that we can help. It's a complex puzzle. It's not the 24-piece puzzle that you give your kindergartner. It's the 1,000-piece puzzle without the picture on the box. But you put it together one piece at a time. One piece at a time. And it may seem endless and like there's no hope, but I promise that there is. I truly believe we and our children were made to be whole, and if that you keep looking and keep hoping and connect with the right resources, you can get there. So remember to have hope, because you were made to be whole. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release, and remember, you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686.